Welcome to Truly Heal and our functional medicine training for health professionals. One subject that always struck a chord when working with health professionals is like, how do we help cancer patients without interfering with the treatment of cancer? How can we support cancer patients while they have conventional treatments, or how can we guide them? Almost every health professional today is confronted with many cancer patients. 1 in 2, 1 in 3 women, this is an overwhelming amount. And in modern day times, we treat the disease and not the patient. And this is what's gone wrong. And many of you have noticed that. So you would like to help, but, well, schools tell you, stay away from cancer. Do not treat cancer. My children study naturopathy and nutrition, and every time the subject cancer comes up, they say, stay away, don't get involved, send to an oncologist. You are not supposed to treat cancer patients. And even MDs are required to send, or refer to an oncologist or an internist with specialty training if they are confronted with cancer, which leaves cancer patients really isolated. They are isolated by education. You don't learn how to help them. By insurances, you're not allowed or you're not paid for helping them, and by politics. And that makes it very isolated, always just oncologists, 3 treatments, and that's it. So what would you like to do? How do you learn about treating cancer? Where do you find all the research? If it's not taught in schools, if it's not something you can learn officially, you need to do your own research. You need to study, where are we? Next slide. You need to study your own or find your own resources. And that is a very, very difficult subject. Believe me, I've done that now for the last 18 years, and it's very misleading. Well, first of all, online, there is a lot of contradictory information. Whatever you find has an opposite. Research papers, conferences, seminars, it's very time involving. And it's also very misleading often because you feel like, oh, that's it, and then it's not. And then someone says something and then you realize it's connected to a sale. It's a very complex subject. To filter hype and hearsay from actual fact, proven facts, is a massive undertaking. And then you've compiled all your research, but how do you make that into a workable plan? How do you implement that into your practice? And all that in your own time and fueled by your own passion to help is a massive job. I found when working with many of the doctors that we learned from that there was a lifetime of trying and testing and different variations of treatment and complementing this with this treatment to see what works best and what not. And that's a long-term process. It's not just something you do. And that's why finding a training program for cancer that really works is not an easy job. And you get easily lost in a world of promise, like GCMF cures cancer, sulforaphane, curcumin, DIM, like all the frankincense. Well, there is one big problem. When I visited Dr. Adam Günnes in Austria, he showed me a folder that thick with research papers for over 100 of those remedies. And he said, Marcus, the big problem is they work in vitro, in a petri dish. And we use the 2 remedies and then, well, cancer dies off, or it stops replicating, or it induces apoptosis. But as soon as we try the same thing in a patient, in vivo, it doesn't work. And the main problem that he contributed, and many doctors do, is that as long as the cause that triggers the disease, which is toxicity, inflammation, infections, all of those, as long as they keep pressing, the remedy will either have only short-term results or will not work at all. And there is a big problem, like in the way those cures are promoted. Oh, my client was in bed for 2 years, agony, pain, suffering, couldn't stand up, was completely exhausted. And then I gave Halin the next day. She felt like newborn. She could stand up. She could go to work. If I'm sick in bed and feel really crap, I'm sold. Give me 20 bottles. I'm in. And that's the sale. But then the mortality rate doesn't change because we haven't removed the root cause of the problem. So to get involved into this project, into this treatment of selling cures is actually quite, well, frustrating. And that's why we've been investing so much time. I've been misled in the same way. I'm not pointing fingers to anyone. I've done the same thing. You know, when the doctors told me this is a great program, this is a great thing, I was equally excited and I promoted black human extract. That's it, that kills cancer. Yeah, well, it didn't. And then it was Mariana, and then it was CBD, and then it was this. So we have that belief, you know, I call it the waves, the emotional waves of belief. We want to believe in those treatments and believe that they work because, well, it's a very, very difficult subject to treat. And so desperate for a cure makes you believe in many things. But what we found when working with all of those practitioners, that there is a different way, a very different way. Not treating the disease, not trying to replace a chemical drug with a natural remedy and hoping it kills. We completely go away from that. And this is where the opportunity comes from, treating the patient and not the disease, which is completely legal, which is completely fine. And that has to do with removing those things which trigger the disease in the first place. Now, we found that when you, let's say, deal with oxygenation, which is a big problem in most patients, you reduce one problem. Then you remove infections. Then you remove pH balance. You know, the simple things that I will talk about today. And then you reduce some inflammation and repair the gut. And then you look at some of their stress levels. All of a sudden, those remedies, of which there are hundreds, can work. But they will not be able to have a long-term effect as long as those triggers are still there. And this is what we came to learn from doctors that, well, have a waiting list of 2 years, have recommendations, you know, to hundreds of patients who are not hoping to get another client. They can't save themselves from clients. And this is a completely different approach. I think we all want to help. And we all want to make a difference. And we all want to earn some money. But by doing it in the way of treating the disease, first of all, we move into illegal space. Secondary, we don't have long-term results. Plus, we become kind of, you know, like we always call it the quacks, which is a word that you shouldn't say. But if you don't have results, you become a quack. Whereas if you provide results to your clients, you improve the quality of life, you improve and change how they feel about themselves, how they can reduce the pain and suffering and enjoy life, you move into a medical field. And this is what this kind of medicine does. And that's what we call truly heal functional medicine. It's not just functional medicine. There is a lot more to it. And I will cover that in a moment as we go to the next slide. Health is not an event. You cannot buy it. You cannot go to a doctor and say, I would like to have 5 pounds of health in form of pills or ointments or whatever. It's a process. It's a process actually of elimination. Eliminating the true triggers that in the first place cause the disease, which is very important. You know, carcinogens are toxins that cause cancer. Very clear, and there's many carcinogens that we absorb. We're usually born with already 150 to 200 carcinogens already inherited from mum, plus we add a lot more. So that's number one. The second part is things that prevent a recovery. See, if your immune system needs to repair tissue, needs to repair your body, it needs to have the nutrients, it needs to have the right environment, it needs to have the right DNA functions. So if that's not supported, the recovery, the repair cannot happen. So combining those two is what functional medicine actually is. So today, I would like to take you through a little bit of a process, because when you come, well, you have a new client and you explain them, well, we need to look at your hormones, and then we need to look at your infections, and then we look at toxins, and your gut health is important too. They go like, oh my God, this is going to be a 5-year process, and until then I'm dead. It can be overwhelming if you present it in the wrong way. So what do we want to do when a client comes in first? fastest, immediate results, to bind them, to show that you're a credible resource, that you have valuable information that makes a big difference right from start. And that's what we look at today, immediate results. In the next video, we look at analyzing a client. What makes them sick? Where does the problem come from? How do we build a timeline? How do we look at their originating causes, weaknesses, organ, system weakness? That is next video, and then we move into gut health, which is probably clarifying what we do today. So let's just move into immediate results. I've been to a practitioner and he was giving me pain relief within a matter of 2 weeks. And I was like, yeah, that's the one. I'm going to go back. And I sent everybody else there because his recommendations are great. And I believe that's the normal thing that always works. So what is the first immediate result when you have any kind of disease, especially cancer, you know, like over here? Well, think about the seesaw, immune system versus cancer, or immune system versus pathogens, bacteria, fungi, mold, all of those infections. So let's go the other way, Here we go, one back. So let's leave it at cancer. If I support my immune system and give my immune system everything it needs, you know, I lift it up and empower it, well, then my tumor load goes down. It's a very normal thing. If I, on the other side, support my cancer and I give them heavy metals and toxins and infections and drugs and high acidity, I reduce the oxygen level in my body, make it very anaerobic. Cancer loves it and it thrives. I give it high inflammation, which, you know, breeds more and more cancer cells, and I add chronic stress, which is pro-inflammatory and completely debilitating to everything else. Well, then I breed more cancer cells, so they go up, and my immune system is completely knocked out. So who do I support? Very simple principle. You know, fever is a very simple program. That is, your body is using it as a self-healing response. You have a high infectious load, you have something wrong in your body, the body produces fever to produce more white blood cells. All of a sudden you have triple, quadrupled your army of soldiers. You know, how great is that? I have more defense after a fever. So that's why fever is one of those miracle cures that a lot of people have observed. They have 2-3 day fevers, very intense fever, and the tumors shrink, they feel fantastic, everything goes away. Fever is not something you should suppress. Oxygen, they need oxygen, I'll cover that. They need alkalinity, I'll cover that as well in a moment. Sleep, well, we all do need to relax and sleep, especially because those gallows work while you sleep. And an anti-inflammatory, nutrient-rich diet, we'll talk about that too. And immune modulators, which you probably know, all the chaga mushrooms and all the things that we add as a cancer remedy to the program, they're just the clubs, they are the guns, the bullets, they are the ammunition your immune system needs to actually deal with those fellows over there. So let's end, like I said, same value for your pathogens. So look at 2 things that you can do straight away to improve your patient's overall energy and your overall support. Number 1, you give them alkalinity and reduce acidity. I am not easy to be convinced. So the very first thing I tried out when somebody explained that to me, I bought a dark field microscope. I looked like a diabetic. I pricked my finger every 2 minutes and checked blood under the microscope. First, I powered it all up, you know, with oxygen and PMF and everything. And my immune system, those white macrophages, those big ones, they were squeezing through the blood cells and were fully active. It always took them about 30 seconds to get started. And then they moved all over the slide. Then I added a cup of coffee with 1 spoon of sugar and drank that. And waited 5 minutes and then added my slide blood underneath the microscope. And those immune cells sat still 3 minutes, 5 minutes, 10 minutes, no movement. Well, that's not what you want. This is exactly what you do when you acidify your body. Sugar, sodas, coffee, alcohol, weed, grains, dairy, processed foods, you know the list. All of that adds to acidity. Now, if I do 1 or 2 or 3 things at the same time and I add some alcohol and then I have some wheat, my acidity levels go through the roof. And that's when your immune system stops working. Just showing that to a client will make them a lot more compliant to work along with you and get them on the right track. Fruits, nuts, legumes, and vegetables completely reverse that process so you can boost your immune system in a massive way. Lack of oxygen, another really important subject. We need oxygen not only for your immune systems to be alive, you also need 100 times more oxygen for the respiratory burst. The respiratory burst is chase and catch floating cancer stem cells and pathogens. So if somebody steals your purse and you run behind them and you run out of breath, well, they can run away and you lose. That's what happens in the body too. So your immune cells for the respiratory burst need 100 times more oxygen. Where do they get that from? They get that from the red blood cells where they squeeze through. They take from every red blood cell some of the oxygen from the hemoglobin. That's why they are in symbiosis, working together. It's like an oxygen supply. When they catch an invader, they need to kill it, which means they need to convert oxygen and glucose into hydrogen peroxide, which is then the killing effect. So again, 50 times more oxygen for killing those pathogens and cancer stem cells. And that's again, if you don't have enough oxygen in your system, all of that won't work. And that's why very simple things which you can implement into any form of practice, whether you're a chiropractor, a nurse, a massage practitioner, an MD, or any kind of physician, simply add oxygen into your treatment protocol. And once you do that, Ardenne, very easy, exercise on the bicycle while breathing oxygen in intervals. Ozone, super fast, 5 effects in 1 3-minute treatment. Exercise, as we said, you have to chase them up the stairs, up and down in your clinic. And then you have hyperbaric oxygen, which is that chamber you put them in and you squeeze with pressure. A really good treatment, but it takes a lot of space. It's very expensive to install. Or an EWAT machine, which is that altitude training, which means you need to convince them to sit with a mask on a bicycle and do some exercise, which is not quite as an easy sell than a rectal insufflation, and their system is primed. Now the next thing is nutrient, feeding my immune system with everything it needs to work. Again, very short, easy supplementation. Recommendation, if you don't prescribe supplements, just tell them this is a sheet, look, that's what I would take, or go to your nutritionist, or they can buy it outright in any supplement store. But it's very easy. Oxygen, we already said that. You can supply that yourself. Zinc, selenium are mandatory. They are the guns, the weapons. Without them, your immune system is not able to kill off cancer cells or cancer stem cells, and not even most of the pathogens. Iron and copper, they need to replicate to help, especially to take up oxygen from the red blood cells. Probiotics, vitamin D3, and not only in a pill, from sunshine too, B6, C, E, and A, very important supplementation, and folate. Now, think about, you just make this basic, simple adjustment, and they feel better in a very short time. Well, you're already on a winner. And now let's look at one of the biggest treatment recommendations you can give. I always say, what is the biggest result? And for me and for many patients, this was the breakthrough. In actual fact, it's sometimes so powerful that you go like, oh my God, it's resolved not only this, it's resolved a whole host of problems. And I share with you one in a moment. Leaky gut. Now your mouth starts here and then it gets one tube all the way down to your butt. And this tube can have little holes. And as bacteria, pathogens, undigested foods, undigested proteins squeeze through that into your bloodstream, into your body, your alarm system goes red alert. Life-threatening problems, so they stop whatever else they were doing, dealing with infections, dealing with cancer, lower priority. First, we need to deal with that main problem, bacteria and pathogens in our system. Undigested proteins are breeding grounds, so they will immediately attack that first. Well, that happens for breakfast, snack, lunch, snack, dinner, snack, late night snack. I realize when you have leaky gut, it's an ongoing process. And most patients don't correlate the signs of leaky gut with an actual problem. And then they have all sorts of secondary problems like brain fog, like tiredness, like low energy, like concentration problems, like psoriasis, like skin eczema, like all sorts of things, arthritis, tendinitis, many, many things, and only triggered by leaky gut. And they don't correlate because, let's face it, a food sensitivity comes with a 2-day delay or 1-day delay. You eat something and then 2 days later you get the response. Well, nobody thinks back, what did I eat 2 days ago? And that's why the correlation is really bad. Healing leaky gut will bring you massive changes in a very, very short time. I've seen patients after 2 weeks of being on a leaky gut protocol, their arthritis is gone, their joint problems are gone, all of a sudden they don't have the shoulder stiffness, they don't have this and this and this and this, and all gone, just from healing leaky gut. Now, that was one of my main problems that I had, and it was pro-inflammatory, and it was just a deadly cycle. It was getting worse and worse. So I had to face it. And I went on to Dr. Ack's program, I went to Dr. Mercola, I went to Dr. Hyman, I went through all the different protocols, and they all give a short-term result. They all help a little bit, but as soon as you go a little bit astray, it's all back. And I was interviewing a clinic in Germany where they treat children with autism and, on the spectrum, with ADHD, with all sorts of problems. And they use rectal ozone insufflations to repair the gut. There is super research. The main factor of ozone is tissue repair. So if I do rectal insufflations, I trigger tissue repair in the colon. And you can see this in this chart. This is the mucous membrane. So the mucous membrane is complete. This is where your immune system lives. Everything is outside and this is inside the blood. So all the nutrients should go through and all the bacteria and undigested foods should stay outside, right? So that's where your immune system works and cleans up and repairs. And well, after 4 weeks of rectal insufflations on a low gamma with medium amount, and that was adults. With children, they use 60 to 100 milliliters, tiny amounts. The gut membrane repaired. And not temporary, not short-term, long-term. If you then add the right nutrients, the right supplementation, which we all add in our coaching program, you learn about all those things in great detail. But as soon as you have that repaired, a host of problems goes away. And that's what will bring you immediate results. Your patients will feel so much better. And by doing so, you not only repair your leaky gut, you also repair infectious diseases in the gut where bacteria overgrowth, bacteria, Helicobacter pylori, any of the Klebsiella, Pseudomonas, pathogenic, anaerobic bacteria overgrow in your gut. They are all treated at the same time with the same treatment, and therefore a complete restoration and recovery is so much faster. And again, infections are priority treated over cancer. They are more dangerous to your system, to your overall survival rate than cancer is. So your immune system will always focus on that first. And that's why dealing with infections, dealing with a dysbiosis in the gut, dealing with leaky gut will give you such dramatic results in such a short time that your clients are hooked for life. A friend of mine went to a doctor who, well, just pointed out dairy making him tired and developed a program how to learn how to observe what happens. So he was 4 days on a non-dairy protocol and then consciously had to eat cheese to see what his energy levels would do. And that was so overwhelming that switched off, brain, couldn't focus, was ready to lay down in the restaurant on the bench and was so knocked out. And that's when it's kind of an exclusion diet. You try out, if you don't do it for a while, and then you add it to the program, and then you see to your diet, and then you see the results. But it's a phenomenal response. And that's something you can build into your patient's protocol to give them very, very fast effects. Now, reduce the workload is in many forms, whether that's toxins, inflammation, high stress, dental problems. A lot of people say, I'm not a dentist, I shouldn't look into the mouth of people. Yeah, you should. If there is everything full with mercury, if they have infections, if they have inflamed gum, if they have residing gum, if there is many bacteria overloads, that's a problem, treating the patient and not the disease. If I reduce that problem, again, I help the patient to feel much better. And it's a completely normal and legal process. So you don't treat cancer, you treat the patient. Now let's recap very short. Do not promote cures. It will bite you in your butt. You might make some money, but you lose credibility. I've seen so many doctors who promoted vegan, vegetarian, and then they stopped doing it. Others went back to eating meat because they realized they lost all the amino acids. And there is a lot more than a single-sided program. It might be good for a short time as a healing program, as a counter effect to what you did before, but it's certainly not a wise decision to go fanatic, and certainly not one size fits all. In the same way as you say, well, laetrile cures, GC-MAF cures, all of those things, you will find that many doctors have tried and they do it for a while and then they drop away. They don't do it anymore. Or they promoted it very big and then they become more and more silent about it until it's completely vanished. All of those treatments have a very short lifetime, yet the memory stays and you were the one who sold it. Rather support what helps a client in the long run. See, boosting the immune system. Cancer is often called an immune system deficiency. Well, let's boost it, let's support it, let's give it everything it needs to do an optimal job. And at the same time, reduce everything that makes a patient sick. Reduce their infections, reduce their toxicity, repair their gut, give them all the nutrients so that their deficiencies are replenished. There is so much to do on this level that will make a patient feel great, that you will always get word of mouth, good referrals. Well, he actually deals with me, not with the general subject. He knows what I need to feel good. Great. Health is not an event. You can't buy 5 pounds of health and expect it to work. It's a process. And to accompany your clients through the process is what I will share with you over the next few days. In the next video, we'll discover organ health. Very important, systemic health, finding out what's wrong, analyzing your client, and that will give you a clear pathway. See, if I know this is triggering the disease, this is contributing to the disease, and this prevents recovery, then I have a treatment plan, and the patient will go like, thanks God, I know now what to do. So they will work with you alongside if you give them a clear understanding. And that's what I try to give you in those next few videos, so that we make it into a process and have long-lasting results. And that's what functional medicine is. Now, I have to be a bit arrogant here because we call it truly heal functional medicine, because we've taken that whole process a step further. Normally when you learn functional medicine, it's like case studies and you find out what works. We've taken that to a whole new level. And that was because we had the opportunity to learn with many different practitioners who developed a protocol, for example, to heal the gut, to reduce toxicity, to deal with hormones. See, if I'm a hormone doctor, I know I need to work with the liver and I need to support the liver because that's where all my hormones are activated. I also need to know that my nutritional values are very important because otherwise my hormones don't work. So we've taken everything that is related to hormones, everything related to systemic health, your renal system, your hormonal system, your hepatic system, the liver detox, or your lymphatic system. All of those have a lot to understand around them. And that's all in those long lines. That's what's in the app. So as you learn through, you learn first the questionnaire, giving you all the clues, all the symptoms, all the insights. So you already know, okay, this is the system we need to look at. You flag it with red. You actually can then check up what kind of tests are for this symptom most relevant. And then you order the test, or you don't need the test because it's very obvious. And then you see the supplements, you see the treatments, you see the remedies, everything in one glimpse, because it's all nicely broken down. And then we interrelate in the next step deficiencies with hormones, or hormones with liver health. And as you do that, you become very proficient in finding out what's wrong with the client. And that's why I call it truly heal functional medicine. It starts with the questionnaire, and it's a streamlined process right to the treatment. And it doesn't treat cancer, it treats the patient and improves their vitality and health. Effective, fast, and with lasting results. See, if you promote a cure, well, the disease reason is still there. So it will always come back and bite you in your butt. Whereas here we remove the cause and then we add one of those remedies, and all of a sudden we have real lasting results. And with the app, it makes it so much easier. This is quite a lot of knowledge that you should keep in here. And then you have some extra space for free time. Well, I needed the app because after a while you learn about something, you're all excited about it, and it's all so fascinating, and then you don't use it for 4 or 5 months and it's gone. So instead of losing my repertoire and allowing it to fade into a minimal protocol, I rather here have it triggered by the questions, shows me, oh, this in these tests, oh, these in these treatments, oh, these in these supplements, and it's back there. And it becomes totally normal to be able to respond to my client's need because I have it right at hand. Okay? Now, if you would like to join our professional team, either as a health coach or as a functional medicine certified practitioner who has a license to treat, simply find the button or the link underneath this video and fill out the form and get in touch with me. I will get back to you as soon as I can. And if you just want a little bit more help or have something to share, please post it underneath this video. You can do so here on the website or on our Truly Heal channel. I'm dedicated to answer them all right? And I'll see you in our next video where we talk about analyzing a client and finding out what drives their disease.